Yeah, just a quick review of the TFUSOM arthritis gloves. So these are specifically made for people that have hand arthritis. There are people using these for other things, but this is mainly what they were intended to be used for. And they work in two ways to help people that have hand arthritis. Number one, they provide compression, and that helps decrease swelling. And so if there's less swelling, you're going to be able to move your fingers better and your hand better. It's going to be less pain. The other thing they do is they provide warmth, which always helps arthritic symptoms. So a few points about these particular gloves. They are lightweight and they are breathable. And they do have an open finger design, which I really like. So that way you can do things like texting, if you want to do sewing, that kind of stuff. And these in particular, you can actually put in with your normal laundry, which is really good. A lot of these arthritis gloves I've been looking at, they hand wash only. But these you can actually just throw in your normal laundry. So that's a big plus. So always the question, would you get permanent relief, temporary relief? I mean, what does these things do as far as like relief for your hands? Well, you put them on and they help, they work. When you take them off, they might not last, maybe like an hour afterwards, once your hand's not warm anymore, maybe some of the swelling can come back. They might not work, but I think there actually are cases where you can use these to get permanent relief of your hand symptoms. Using these gloves, but you got to use them. For chronic pain, a lot of times you need like a multi-pronged treatment approach. So you need several things to get you where you want to be. So what I would recommend is doing something like, right now we know the gloves will help you, but you're not going to wear them 24/7 most of the time. And let's say other things will help, like say exercise. Okay, so we all know that exercise, strengthening your hands, stretching them out, always helps symptoms, and can actually give you some good, take a big bite out of your pain, give you a lot of long-term relief. But you're not able to do it right now. So what you do is you put these gloves on. After about 30 minutes to an hour, you're able to move your fingers better, your hands, you can move your hand around better. Now you can do some of the other things that would give you the longer term relief, like hand exercises. So for instance, use this as an example, Treat Your Own Hand and Thumb Osteoarthritis by Jim Johnson PT. They have like some exercises you can do, like to get rid of stiffness, for instance. That would be like range of motion exercises. So if you go to like hand therapy, like an occupational therapist, they always do range of motion exercises. And why? Well, there's several reasons. Number one, you need full range of motion, for the joint to do its thing. If you don't have as much range of motion, your function is decreased. But the joints in your fingers, they're like synovial joints, which means that they have synovial fluid in them. Synovial fluid is produced in a synovial joint, and that's where the joint gets its nutrition from. But the synovial fluid gets dispersed throughout the joint by movement. So every time you move around, full range of motion, you kind of slosh that synovial fluid around, and so it provides nutrition to the whole cartilage in your finger joints. However, if you have decreased pain, you're not able to move a joint through the full range of motion. Parts of that articular cartilage that just aren't really getting the nutrition that it needs, which compounds the problem. So range of motion exercises are definitely a good way to get rid of stiffness and help the arthritis in your hands and fingers. There's also things like strengthening exercises you can do. It doesn't involve, spending an hour doing exercises, just spending like maybe 10 minutes, a couple days a week, 2 or 3 times a week, using things like a light dumbbell. There's exercises you can do. Even if you have like base of thumb arthritis, you might think, oh, there's nothing I can do about that. There's actually a muscle called your abductor pollicis longus that attaches to the base of your thumb, right where you're having problems. If you strengthen that muscle, you get more stability in the joint and you have less pain. So actually there are things that you can do if you know how. But maybe you can't do them now. You put the gloves on. The gloves enable you to do something that can get you the longer term relief. So yeah, I'm all for these gloves. So yeah, definitely check it out.